Hello, my name is Tim Couch. I'm a student at Eastern Kentucky University, and today I'd like to talk to y'all about cognitive behavioral therapy for the treatment of anxiety in the adult population. Anxiety is a mental health problem that greatly impairs the lives of countless individuals at the national, state, and local level. Anxiety is a notable issue that psychiatric mental health nurse practitioners see in various treatment settings. Generalized anxiety disorder is characterized by excessive and uncontrollable worry. The symptoms of anxiety disturbs the individual's standards of health, comfort, and happiness. Anxiety disorders are more prevalent in women, people younger than age 45, individuals who are divorced, and individuals of low socioeconomic status. According to the National Institute of Mental Health, 2017, 4.1% of the adult population suffer from a severe form of anxiety disorder, and 18.1% of adults suffer from some form of anxiety disorder. Two randomized controlled trials were selected for review. Study number 1. The purpose of the first randomized controlled trial was to examine the effects of cognitive behavioral therapy and applied relaxation on symptoms of generalized anxiety disorder. Specific symptoms monitored were time spent worrying and physical symptoms of anxiety such as restlessness and muscle tension. Cognitive behavioral therapy consists of psychoeducation, worry awareness training, and problem solving. Applied relaxation consists of psychoeducation, tension awareness training, and relaxation techniques. This study took place in an anxiety disorder clinic. A sample of 31 participants in the cognitive behavioral intervention group and 26 participants in the applied relaxation control group. Inclusive criteria included a primary diagnosis of generalized anxiety disorders to be between the ages of 18 and 64, stable psychoactive medication, no suicidal ideations, no current substance abuse, no current or past schizophrenia, and no bipolar disorder. Study number 2. The purpose of the second randomized controlled trial was to evaluate the effectiveness of cognitive behavioral therapy and emotional freedom technique in the treatment of depression and anxiety. Specific symptoms monitored were anxiety and depression. Cognitive behavioral therapy was aimed to modify distort thinking and dysfunctional behavior. Emotional freedom technique focuses on distressing thoughts. This setting took place at a university. It was a sample of 4 participants in the cognitive behavioral intervention group and 4 participants in the emotional freedom technique group. Inclusive criteria included male and female participants to be older than 18 years of age and screened positive for a major depressive disorder. Synthesis. The 2 studies reviewed were very similar. Each study had the same independent variable of cognitive behavioral therapy and the same dependent variable of anxiety symptoms. All studies involved the adult population. All studies found that cognitive behavioral therapy was effective at reducing anxiety symptoms in the adult population. Weakness of each study contributed to the gaps in research. Both of these studies have shown valuable information that can be applied to the practice of a psychiatric mental health nurse practitioner. The knowledge obtained from the results of these studies could assist the nurse practitioner to improve the quality of life of individuals in distress from symptoms of anxiety. Intervention proposal and appropriate healthcare environment. The findings within this research could be applied to the mental health nursing practice. there is outstanding amount of adults in distress due to some type of anxiety disorder. Therefore, the psychiatric mental health nurse practitioner must be ready to initiate treatment. Having evidence-based knowledge about cognitive behavioral therapy can assist the nurse practitioner to reduce anxiety symptoms. Based on these findings, cognitive behavioral therapy is an effective treatment option to reduce anxiety symptoms. Traditionally, symptoms of anxiety is treated only with medication. Using only cognitive behavioral therapy as a plan of treatment for individuals in distress from anxiety could improve the future of a psychiatric mental health nurse practitioner's practice. This practice change could be implemented for inpatients on a psychiatric unit or in an outpatient mental health clinic.